Hello, everybody. This is Gary. Today is January 1st, 2022. It is 2:04 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm in less physical pain than I was yesterday and the day before. I saw my practitioner on the 29th, and she's prescribed some pain medication for my skin. It's 5% lidocaine because I have a lot of muscle and joint pain all over my body. My psychiatrist is withdrawing me from Neurontin slowly. It's causing me a great deal of physical pain, but I'm in less physical pain today than I was yesterday, although still some pain. I've been using Aleve, which is an over-the-counter painkiller, to reduce my joint and muscle pain. My insurance hasn't approved the lidocaine medication yet. My doctor has to contact the pharmacy to get my insurance to approve the medication. The medication is very expensive. Without my insurance covering it, and my insurance requires what's called a prior authorization, which my doctor has to put in a special request for my insurance to approve the medication. And my doctor's office won't be open up until Monday, so I won't be able to pick up that particular medication until Monday at the earliest. I'm not seeing my psychiatrist until February. I do have an appointment with my therapist, I believe, this upcoming Wednesday, and on Tuesday I have my first group therapy session, what's called dialectic behavior therapy. If you want to know what that is, just Google dialectic behavior therapy or DBT. I'm not going to get into it right now, but I'll be going to group once a week for an hour and a half for the next 12 weeks. And I will continue to see my therapist about once every 2 weeks. So I still have a lot of leg pain, joint pain. The pain comes and goes. It flares up and it decreases, then it flares up again. I do want to continue to withdraw from the Neurontin over time. My experience is that it's a very addictive drug, and the sooner I get off it, the better. I've been on it for such a long time that going off it is causing a great deal of pain and discomfort. But I do want to get off it. And my general practitioner told me if I insist on giving off the Neurontin, I'm going to experience inevitably some physical pain and discomfort. If the pain doesn't get any better, my primary care physician told me to contact her later on. Also, my cholesterol levels are high and I'm pre-diabetic. Both of those things can be blamed on the Seroquel. Seroquel tends to make me overeat, eat the wrong things, so I have high blood sugar and I have high cholesterol. Although I'm also not smoking cigarettes anymore, the cholesterol and the high sugar still present possible health problems like full diabetes and a heart attack. Psychologically, I'm doing better today than I was yesterday. Yesterday, I was pretty much immobilized by physical pain, fear, anxiety. I didn't sleep for the 2 nights before. And when I don't get any sleep, my mental health deteriorates pretty quickly. I did get some sleep last night. I slept from about 9 p.m. till about 5 a.m. Woke up, fell back asleep a couple of times, but I got more sleep last night than the previous couple of nights. I was tempted to go to the psychiatric emergency room, but I decided to because I wasn't actively suicidal and I certainly wasn't actively violent. And it being New Year's Eve, The psychiatric unit was probably packed. The emergency room was probably packed with patients. It usually is on the holidays and on the weekends, and when you combine those two things together, the psychiatric emergency room is totally fucking chaotic, and it's not a place that a person wants to be if they can avoid it. My hallucinations are not that bad today. My paranoia is not that bad today. My depression is pretty severe. My anxiety levels are kind of high. My delusions are not that bad. It's just the physical pain and discomfort. Um, I've had some bleeding when I go to the bathroom in my urine. I was scheduled to see my urologist in February. They're going to do a cystogram to determine where the blood might be coming from. Um, because I had prostate surgery and bladder surgery, and I have occasional bleeding out of the tip of my penis. If it gets real bad, I'll go to the emergency room, but so far it's only been a little bit of blood. I did take some Klonopin as Zyprexa this morning, along with my regular morning meds. I was able to stick to my daily schedule today, which included work, making this video, meditation, and going outside for exercise today, which I did earlier. The weather in Rochester is not that bad, although there's a winter advisory coming up for upstate New York. It's supposed to snow really hard, I guess, in the next day or two. I don't let the weather stop me from going out and exercising because, like my doctor pointed out, I am considered obese and I need the exercise. And I'd rather exercise outside than indoors, regardless of what the weather is like. Um, Other than that, there's not much to report. Share, like, comment, subscribe. Press the notification bell.